first thing when you dissect this heart too is going to be able to figure out anterior from posterior. So the easiest way is that coronary groove with the coronary sinus is going to be on the posterior side.
That's the coronary sinus?
That's the coronary sinus. You can see all the coronary veins are coming towards it. And so the ventricles are below, the atria are above. So since we know that's the posterior, we're going to flip it back over. So here's our anterior. Right side, left side. Tip is always the left ventricle. So this would be the left auricle. This would be the right auricle. Okay. So this is all the right ventricle. This is the left ventricle. You can see here too there's going to be a groove, the interventricular groove that's going to show, or sulcus that's going to divide the right and left. And when you look at the heart too, the bigger muscle is going to be the left because it has to pump blood everywhere. So if I flip this open, somehow, there it goes. Okay, so blood's going to come into the right atrium, right, through the inferior vena cava and the superior vena cava. It passes through the tricuspid valve into the right ventricle. And you can see the chorda tendineae, they're half ripped. Papillary muscle, this has a halfway decent papillary muscle. Passes from the right ventricle through a semilunar valve, the pulmonic semilunar valve, or pulmonary semilunar valve, into the pulmonary trunk, which divides into a left pulmonary and a right pulmonary artery. It's going to go to the lungs and come back through 4 pulmonary veins into the left atrium, pass through the mitral bicuspid valve, into the left ventricle. There's papillary muscles, chorda tendineae. Pass out the aortic semilunar valve right there into the aorta. And on this model, they just have 2 of the branches. So this first one would be the brachiocephalic trunk, which is going to branch into a right subclavian and the right common carotid. They have the left common carotid, and they didn't give you what's over there, the left subclavian. You can see right there should be a coronary artery coming off. Right there is another coronary artery coming off. On this one too, I think you see there's the fossa ovalis in there. See that little thing?
Yeah.
See that little depression right there?
Yeah.
So that would be the fossa ovalis.
Where is the coronary sinus?
Coronary sinus is right here.
Where was that
So
fossa?
does right atrium go to coronary sinus?
The coronary sinus is going to drain into the right atrium. So all deoxygenated blood comes back to the right atrium. The right atrium collects deoxygenated blood. The left atrium collects oxygenated blood.
Oxygenated.
So what?
And those ridges are the chorda tendineae,
So
or the the trabeculate cornea.
So before the blood, the oxygenated blood go to the sinus, coronary sinus.
Deoxygenated. So these are the veins. These are veins are draining the heart. The arteries are carrying the oxygenated blood to the heart. They go through capillary beds. They come back through veins. All the veins drain in the coronary sinus, and the coronary sinus drains into the right atrium. Making some sense?
Yeah.
Okay. You see the ligament arteriosum there? Yeah. Between the pulmonary trunk.
That's
and
the one you were
aorta.
saying is when your umbilical cord.
When you're in your utero, when you're your fetus in utero.
What is there,
So it's a
like some
shunt.
kind of hole or?
It's a tube. It's like a duct. It's a duct. You know, it's not lined by cuboidal epithelium, though. It's probably simple epithelium.
It's
Simple epithelium.
You know when you did the track? Like when you did the arrow to the arrow? I really like that.
What was
Oh,
that
That helped
called?
me a lot.
Okay.
What was this called?
Ductus arteriosus. But now it's the ligamentum arteriosum. So it looks like a ligament
Oh, so you're saying ductus is when you were.
in utero, when your mom's uterus. When you had amniotic